Let's start. Come, let's go.
You're muted, Dr. Sanyitobi. You're muted.
Yes, I know.
Okay. All right.
Yeah, thank you. Thank you, Mr. Mustafa. So I think we can start now. Good evening, Her Excellency, the First Lady of Lagos State, Dr. Mrs. Claudiana Ibijoke Sanwo-Olu. Good evening, HEDG, Chief Mrs. Oluremi Amzat. Good evening, Council, mommies, aunties, sisters. You're very much welcome to this edition, this July podcast. And good evening, Dr. Folakemi Koladefe, facilitator for this month's podcast. You're very much welcome. And on behalf of our team lead, Professor Olufunke Adeyeye, I welcome everyone to this edition, this July podcast. I would like to give you a brief on Dr. Olufolakemi Koladefe. She's a consultant, physician, and dermatovenerologist at LASUTH. She's also a lecturer at the Lagos State University College of Medicine. She's a member of the West African College of Physicians and a fellow of the National Postgraduate Medical College of Nigeria in internal medicine and dermatology. She also has a diploma in tropical medicine and hygiene from the London School of Hygiene and Tropical Medicine and masters in public health and health promotion from Brunel University, London. She's an alumni of the ILDS Global Derm Mentorship Program. Dr. Koladefe is a clinical researcher. She works on various areas in dermatology and global health, including albinism, skin care practices, and skin biophysical parameters in Africa, and equity in dermatological care. She's also a skin health advocate and frequently engages and educates the public about good skin health practices and skin conditions on the radio, television, and social media. She was awarded the 2025 Young Dermatologist International Achievement Award for the African region by the ILDS for her contributions to advancing skin health in Africa. So I'm sure you know that there is no better person to discuss this month's topic. And our topic for this month will be normal aging and coping mechanism. We're talking on skin health and hair loss. Dr. Folakemi Koladefe, you're very much welcome to Calso podcast. Thank you so much for honoring this invitation. And I would say now that you have the floor. So we can't wait to have what you have to say to us. Thank you so much.
Thank you very, very much for the warm welcome. It's an honor and a privilege to be speaking to all the wonderful, highly esteemed ladies of Lagos State, my home state. I'm a Lagosian, and I'm very, very much happy to discuss this very important topic, which is normal skin aging, skin health, and also hair loss. These are things that are very important for us as women because, as we know, we are more focused, or we take more, we look more after ourselves, our skin, our hair, and every part of our bodies. And we also take care of others. So I know that we're supposed to start with like a pre-test. So I think maybe we'll upload that first.
No,
And
you can go ahead, ma. You can go ahead.
okay,
Just keep that.
all right.
Thank
Okay,
you.
that's fine. So I'm just going to share my slides, if that's okay. I know the time is a bit against us. I will try to be very brief so that we can have enough time for questions and answers. So please let me know if you can see my slides.
Yes, we can. Thank you.
All right, perfect. So I'm going to be talking about this topic on healthy skin, normal skin aging, coping mechanisms, and then skin health and hair loss. Right. And I'm going to be following this outline. So what's the skin, a little bit about the skin, what is behind skin aging, the features, hair loss, conclusions. So let me start by saying aging is not lost youth, but a new stage of opportunity and strength. And we'll all age. It's inevitable. It begins the day we are born, and it's highly personalized. People age differently. And there's no single measure of how old a person is. Sometimes you can't really tell how old or young someone is just by looking at them because we are all uniquely different. So aging occurs at different rates for different people. But what do we mean by aging? Things like, having more wrinkles on your face, a few lines here and there, some changes in the tone and texture of the skin, loss of elasticity or loss of youthfulness. And there are many things that cause it. It's a complex and multifaceted process, and everyone is going to age. So a little bit about the skin. The skin is the largest organ in the body. It's about 1/6 of our body weight, and it serves multiple functions that are very important for our health and survival. Now, the primary layers of the skin, there are three major layers. There's the epidermis, the dermis, and the hypodermis. Those are the three main layers of the skin. And the skin also has appendages. Appendages are things that are also, they're not layers of the skin, but they're attached to the skin that make it function better, like hair, nails. And then we have the glands that produce sweat and the glands that produce oil underneath the skin. And skin has many functions. It helps prevent infections. It helps maintain a healthy, it's a barrier against the outside world. So against infections, against us losing fluid from our bodies, because our bodies are like 70% water. So the skin helps to keep in some of the fluid and the water in our body. Also prevents us against things, elements in the environment. And then it also helps us to repair injuries on the skin. It provides circulation. It also helps us to lose sweat, so waste products, excretion, and communication, touch. And, we feel touch, we feel cold, pain. Then our skin helps us to activate vitamin D, which is a vital molecule for normal good health, of course, from the sun, using UV rays from the sun. It helps keep us warm and regulates temperature. So when we're warm, when we're cold, is able to trap heat. When we are hot, is able to dissipate heat by making us sweat. And of course, it's our cover, it's our ambassador. It's what represents us. So it has beauty and social value. It has several functions. And then skin comes in different colors. So we have dark skin, we have light skin. There's what we call the skin phototypes, type 1 to type 6. That is a rough estimate of your skin tone. Now, 1 and 2 are usually Caucasians. 3 and 4 are people that are from the Middle East or from the Mediterranean. And then 5 and 6 are usually us dark skin Africans. And the good thing about our dark skin color is it's kind of protected against skin cancer. So we have a much lower risk of developing skin cancer because we have more melanin. Melanin is protective, but melanin also helps us to get darker easily or have hyperpigmentation or dark spots on skin. Now let's go back to skin aging. There are two main types of skin aging, how our skin ages. It can age what we call intrinsically. This is a natural process that happens to all cells in the body as they continue to function, they become weaker, and then the repair mechanism kind of slows down. And then as a result of some of the influences, just like a car, if you buy a brand new tear rubber car today, it's gonna, be really, really great for a couple of years. After some time, you begin to notice wear and tear here and there. And that's the same thing that happens in our bodies with aging. So internally, a lot of the processes, the continuous processes can cause skin aging. Then we also have the extrinsic, that's the environmental factors that contribute to skin aging. Number one is UV exposure, that's the sun's rays. Then there are other things like smoking, pollution, the kind of food we eat, hormonal disorders, and chronic diseases. So lifestyle can affect our environment, and pollution and all that. So 70 to 80% of extrinsic aging is from the sun, photoaging, that's UV exposure. Then, as we mentioned, so many other things, including stress, including nutrition, ill health, environmental pollution, and other things. So these are some features of aging. The skin becomes weaker, there's reduced elasticity, and there's also, it can also affect the hair. So the hair follicles also have increased sensitivity to testosterone, and this causes them to thin out over time. And that's why a lot of people, particularly the men, as they get older, their hair gets. And so these are some of the features that we see with aging. And then photoaging is one of the major issues, which I mentioned is caused by UV radiation. UV radiation is from the sun. There are two types of UV rays. When they come in contact with the skin, they cause the skin to get thicker, to become drier. They can cause the skin to produce excess pigments. And that's why we notice that the parts of our bodies exposed to the sun tend to be darker than the parts of our bodies that are covered by clothing. And if you also notice, the skin in the areas that is covered by clothing is always smoother and fresher than the skin that is exposed to the sun more frequently. And this is an evidence that a lot of skin aging is driven by sun exposure and UV radiation. Smoking is not good for the skin, as we would know. Smoking has literally almost no benefits, and it's also bad for the skin. It helps to reduce the quality of the collagen fibers that keep our skin look youthful and plump. And so people that are exposed to smoking or smoke themselves tend to have their skin ages faster. And smoking is not just cigarettes. A lot of people that fry, that engage in using biomass fuels, like they use kerosene or cook or firewood to cook, are also exposed to the same kind of smoke that you have in smoking cigarettes. But wrinkles are a sign of aging, but they are also a part of life. So we are in a world where aging is seen as a bad thing, and a lot of people are like, oh, we need anti-aging. But most of us dermatologists believe aging is a privilege and we should age gracefully. We shouldn't try to be anti-aging, but we should be pro-aging gracefully. Because aging is a blessing. We all hope to grow old and see our children and children's children. And so it's inevitable if we are blessed with that will age. So wrinkles, this is a quote that says, wrinkles merely indicates where smiles have been. So people that don't smile very often probably will have less wrinkles. But then, what's the quality of happiness in your life if you don't smile and you're always keeping a straight face? So that's just food for thought. So these are signs of skin aging. You have dryness, itching. Sometimes the skin is flaky, like just there's low levels of oil or sebum. And when the skin is itchy and when the skin is dry, it tends to itch. And this usually is worse during dry seasons. Then there's reduced elasticity. So if you pinch the skin, it takes a longer time for it to return to its normal place. And then, of course, the wrinkles come in. You begin to have wrinkles on the forehead, under the eyes, by the sides of the nose. And these are things that occur as we get older. Then in us dark-skinned people, we tend to have benign spots. So I'll show you what that looks like, what we call skin tags. So these are signs of age. These are aged faces, different things. You have the wrinkles on the forehead. You have the side of the nose, this nasolabial fold being more prominent. And then the skin is very thin and loses its firmness. Sometimes the skin, you also have bleeding into the skin. We don't see this so much in us Africans that have a darker skin, but in Caucasians, bleeding into the skin in the elderly is quite common. However, we are beginning to see this in people who bleach their skin. So people who are engaged in skin bleaching, it makes their skin so thin and then they begin to have bleeding into the skin like this, bruising once in a while. So in us black skin, these are the things we tend to see with aging. Discoloration. As you can see on this face, there's this discoloration, which is as a combination of sun exposure and probably using some wrong creams. And then we also have these spots that people call skin tags, but they're actually called DPNs or seborrheic keratosis. And it's quite common on the face, can occur also in pregnancy and in old age. And then we see this on our legs as well. These light white spots, which are as a result of aging as well. So what happens here is that some of the cells that produce color, they retire. They're like, okay, I'm no longer going to work anymore. I've given up, I've done enough. And so the areas in that those cells are meant to cover for giving the pigment or the color of the skin are now left without any color. And that's also a sign of aging. Skin aging can also be accelerated with some medical conditions. So itchy skin, dry skin can be a sign of an underlying medical condition for the kidney, the liver, the thyroid, diabetes, and even cancer. And then the skin tags, like the one I showed you, or the DPNs, can be a sign of what we call insulin resistance or metabolic syndrome. And so for most people, when they begin to have a lot of those on their face, I tend to ask them to go for to check their blood sugar, their lipid profile, just to be sure that those things are in order. And then delayed healing of the skin can also be a sign of diabetes. As we know, people with diabetes are prone to infections and poor wound healing. And then some medications can also cause skin aging, like I mentioned, steroids and skin lightening products. So the word anti-aging, as I mentioned, needs to be struck. We dermatologists are pro-aging. We want people to age with grace, with intelligence, and with dignity. And aging gracefully means finding beauty in every new season of life. We shouldn't be at the age of 50 and want to look like we are 20. We should look like a beautiful 50-year-old lady and carry that with pride, because 50 is not easy. 60 is not easy. It's a blessing. And so we shouldn't be trying to anti-age, because anti-aging in a way is saying you want to die. Because if you are going to be alive, you are going to age. And so we should be happy to age gracefully and not try to reverse or stop the aging process. So how do we age gracefully? Now, it starts from what we eat. Care of the skin starts from within. Our healthy diet with fruits, vegetables, and healthy fats. Example of healthy fats are avocado, mackerel fish, oily fish. These have fats and oils that are healthy for the body. Then drinking enough water helps to hydrate the body from inside, and this also has a positive impact on the skin. We need to reduce junk foods, carbohydrate, processed foods, because these put more pressure on the skin and have been linked to accelerated skin aging. Make sure that our food is rich in multivitamins, and if we are not taking enough, we take supplements once in a while. But the best option is to take healthy food and not supplements. We also need to sleep regularly. Eat 7 to 8 hours a day is what is recommended. Worrying helps us to age faster, as we know when we're under stress. It can make us age faster. So we must always take time to relax, laugh, and play with our loved ones, with our families and friends. Exercise is great for the skin, keeps the skin young, it keeps the muscles in tone. And when the muscles are in tone, they secrete hormones and molecules that help the skin to also stay young and toned. Loving relationships have been great for the skin as well. And then regular medical checks, seeing a dermatologist early when there are skin concerns and not just trying trial and error or listening to people to give advice when they are not qualified to. Now, a dermatologist recommended skincare routine for pro-aging or for healthy aging, you should have a good cleanser, a pH balanced cleanser that is close to the pH of the skin, is not harsh. So medicated soaps are a no-no. You want to use gentle cleansers, then you must moisturize your skin. Whether you have oily skin or dry skin, it's best to moisturize your skin. And as one gets older, the skin tends to get drier. So there are some people that say, I don't use cream. Yes, that may be okay in your early years, but as you get older, you will notice that you do need to use cream because your skin is dry. So using a good moisturizer is also important. Now, sunscreen is advised for everybody. Some people believe that Black people don't need sunscreen. Black people do need sunscreen to prevent accelerated aging. We don't need sunscreen to prevent skin cancer because our melanin is already doing a great job at preventing skin cancer. So we don't have much skin cancer in Black people because of our dark skin. Our dark skin is like a real good protection. That's why people that have skin cancer in this environment are people with albinism, people that have bleached their skin for a very long time are also at increased risk of skin cancer. But the average Black person will not have skin cancer from the sun because of our skin tone, our skin color. But our skin can also age from the sun, and so protecting it with sunscreen is what we advise. That's important. Then using antioxidants because of the pollution in the environment, in the atmosphere. This pollution has a negative effect on our skin. And so you need something to reverse the effect of pollution and pollutants. We live in an industrial city in Lagos and we're exposed to a lot of pollutants. And so we do need antioxidants to reverse the negative effects of pollutants on our skin. Things like vitamin C, vitamin E, niacinamide, resveratrol, there are many types. They are good for the skin. Now, exfoliating helps because as you get older, your skin is not able to exfoliate on its own. In young people, exfoliants are not needed because the skin rapidly exfoliates by itself, whether you use exfoliants or not. But as we get older, that process becomes slower, and that's when the skin starts becoming dull and looking dry and scaly. So using an exfoliant can help to reduce that. And then remember that your skincare products are not for skin type. Like some people say, oh, my skin is light, so I need something for light skin. No. Whether you are ebony black or ivory white, the kind of skin products you use can be exactly the same if you have the same skin type, whether your skin is oily, dry, sensitive, or combination or normal. So how to manage skin aging? Sun protection, very important, as I've mentioned, lifestyle, as I've mentioned, pH balance cleansers, preferably acidic cleansers. These help to keep the skin younger. And then you want to moisturize regularly, you want to exercise, you want to avoid skin bleaching. Remember, being proactive about your skin and skin aging is much better than when the skin has aged, you are trying to fix it. Usually it's difficult to fix, but it's easy to prevent. So this just shows all the things I've spoken about: water, sun protection, avoid smoking, eat a balanced diet. So with photo protection, I'll go a bit further. Sunscreen is not the only method of protecting your skin from the sun. You need to limit exposure during the peak hours of the day. You need to also ensure that you seek shade as often as possible. Wear hats when you are going to the beach that can protect your eyes and your face and your neck, and wear sunglasses as well. And then use a sunscreen with a broad spectrum sunscreen that has a sun protection factor of 30 and above, and a UV protection factor of 3 pluses. This is what is recommended, both UVA and UVB protection. And for sunscreen, when you are outdoors or you are sweating, you need to reapply it every 2 hours. If you are indoors and you're not going out, you don't need to reapply it after you've used it once in the morning. Then there are topical treatments that we dermatologists recommend to manage skin aging. One of them are retinols, retinoids, and we also use things like peptides. We also recommend antioxidants and then the exfoliants. These are things that may be included in your skincare routine when you are seen by an aesthetic physician or a dermatologist to help combat, the skin aging or slow down the process of skin aging. And many people have problems with dark patches and dark spots with skin aging, dark patches around the eyes, around the face. This is a patient who has melasma. You can see these dark patches on the face that occur usually from 30s and 40 from 40 years of age up to 60s. And so we usually give skin lightening agents to get rid of the discoloration. But these skin lightening agents are only used for a short period because when they are used for too long, they can also damage the skin. Then in some cases, some systemic things, oral antioxidants like vitamin C and E, we recommend sometimes. And then we also recommend people to have hormonal therapy in some cases when they are postmenopausal. This can help reduce some of, they can reduce the rapidity of skin aging and all that. And then going for regular medical checks also to make sure one is in good health is also important. There are some procedures that are done. I'm sure everybody knows now. Beauty and aesthetic clinics are all over Lagos, but you have to be careful that you go to the right place, not the place that your skin will be damaged. And these are some of the procedures that can be done to manage skin aging: chemical peels, lasers, microneedling, and radiofrequency ablation, fillers and Botox. Botox can help with the lines, and fillers to fill out all the areas that are falling due to, the aging process. So these aesthetic treatments can help to improve. So it's not going to change you from being a 50-year-old to a 20-year-old. Maybe it may reduce the way one looks by about 5 to 10 years, but what happens is you have to do them in moderation, because we are seeing a lot of people doing too much of this product and they look like plastic dolls, and they don't even look nice at all after spending so much money. So it must be done in moderation and by experts, well-trained people. These are examples of some surgical lifts. This person had facelift with blepharoplasty, which is just reducing some of the wrinkling under the eyes. You can see this lady also, they lifted up the chin a bit. This person had a hair transplant as well for balding. This person had removal of the skin tags on her face. This person had this discoloration, so it was treated with topical treatments. This person had lines, the wrinkles on the forehead, so Botox can help to deal with this. And then the lines around the mouth can be dealt with fillers. As you can see here, the nasolabial lines. And also we need to counsel, because counseling is so important when we're dealing with skin aging, because as I've mentioned, we have to set realistic expectations, and then you can't be treating skin aging and then you go home, you don't use sunscreen, you eat anyhow, you don't drink enough water. You're not going to get the best results. So skin age is an inevitable process, and it can be managed or slowed down with prevention. And the symptoms will guide what we were going to do. Lifestyle changes are important in managing skin aging and helping us to age gracefully. And an expert should always be consulted, not just any beauty spa, not just anyone who doesn't have proper training. And regular medical checkups are important, because it can also be a sign of underlying conditions. And also to quickly touch on hair loss. Hair loss is very important. It's very common in our environment, and there are different causes. One is genetic. People bald. If it runs in your family, your dad is bald, most likely it's going to come to you when the time comes. Then hormonal changes, in pregnancy, menopause, this can affect thinning. And in men too, there's what we call andropause, and men also have balding. Lifestyle factors and stress can also trigger hair loss. Emotional stress, unhealthy lifestyle, lack of sleep, a poor diet. This can trigger hair loss. Then hair practices, which is common in our environment, can make us lose our hair as well. Too much of pulling of the hair, styling, wig glue, and all those things damage the hair follicles. Medical condition like anemia, low blood levels, iron deficiency, thyroid function. This can also lead to hair thinning, infections. So of course, we notice the hair is shredding, is thinning, there can be bald patches and all. Some forms of hair loss are underlying medical or autoimmune conditions. And so it's always important to see a doctor, a dermatologist, because a lot of times when people have hair problems, they don't know that they are meant to see a doctor. They go to the salon and ask the person in the salon to give them a cream for the hair. And unfortunately, many people we see with advanced hair loss, If they had come to us earlier, we would have been able to stop the process earlier. Because they didn't realize that doctors treat hair loss, they go to the stylist and they just keep getting creams that are not helping, and they come quite late. So early presentation to the dermatologist with hair loss is important. You may need to take a biopsy to do that to make a diagnosis. Then a healthy diet, stress management, gentle hair care is also important to managing hair loss. So finally, I'll say aging is not a curse. It is a privilege denied to many. So let us embrace aging with gratitude and age with grace. Thank you very much for listening. And please follow me on social media if you are on Instagram. I regularly give health tips and health talks to educate people about how to take care of their skin on my Instagram page, Fola Demadoc. Thank you so much for listening and welcome questions and contributions and comments. Thank you.
Wow. Thank you so much, Dr. Koladefe. Thank you very, very much. You've said so much today. You've touched on different aspects of the skin. You've actually also opened up a topic that, we may not really have thought about, the aesthetic part of skincare, and that it's still okay to, access these facilities and all that. And it's just proper for us to do it in the right way. And that we shouldn't think of anti-aging, even though most of us still think we need to anti-age, that it's pro-age, embrace your look. And at every stage of your life, you should just try and be the best, the best look that you can achieve. And you shouldn't be thinking of, becoming 20 when you're 50. That it's still okay to be 50 and still look good. Thank you very
Yes.
much. Thank you very, very much. We have some questions, but I'll wait for the people, our mommies on the platform, for them to ask any question that they have. So please, you just exercise some patience and let them ask, and then you answer them as many as you can. Thank you so much. So
No
questions.
problem. Yeah, look
I
at
don't
the
know
chat.
if there are any questions on this platform.
I see
Everyone is
my
just saying
Prof.
thank you, thank you.
Adeyeye. Thank you, ma.
Yeah, everyone is just saying thank you to you. Thank you so much. Thank you so much. So I don't think there's any question for now. So in the meantime, I have a question for you. So in terms of this all this blue light, red light, green light, I'm sure you've seen a lot of face masks that are being sold in shops and all that. Are they
Yes.
safe? Can we use them? Like, or are they to be used under guidance, or can we just buy and just use and then,
No.
Yeah.
I won't advise us to just buy because they are being promoted or marketed. Some of them have benefits, but some also don't. And then also whenever you're trying to get any skincare recommendations, you have to think of our skin color because there are some things that can be good for a white skin that may not be so good for our dark skin. For instance, the blue light is good for white skin, but with dark skin, it has been known to cause hyperpigmentation. So if you're using that, you may end up developing some excess darkening of the skin, which most people will not like. So I would say before you buy any device or product, try to seek the expert advice of a dermatologist. Is it really needed? How often should you use it? Is it from a trusted source? There are so many things coming from China, from Asia. We're not sure of the quality, the efficacy, or the safety of some of these products. So we need to be cautious and not just follow every trend that we, find on the market or on social media.
All right. Thank you so much. So someone has asked the question, how can one treat a fungal infection?
So fungal infections are very common in our environment. The first thing is the skincare, making sure you are not using anything that will promote fungal infection. Things like antiseptic soaps. Antiseptic soaps are not good because they remove the healthy bacteria that is on the skin. And that healthy bacteria are like tenants that are paying rent. They are doing something good for you and they're also living. So when you take off the healthy bacteria on the skin, that's when the fungus can then overgrow, because most of these antiseptic soaps are antibacterial. So we find that if you're not using an antiseptic soap or putting antiseptic in your water, the second thing is you're not using lightening creams or toning creams, because all those toning and lightening creams also reduce your skin's natural immunity. And so your skin is more susceptible to fungal infections. Then when you do have an fungal infection, you need to even be sure there's a fungal infection, because there are many things that people think are fungal infection, but maybe something else like psoriasis or sarcoidosis or other conditions, especially when you treat and it doesn't go away. Then the problem we're having in the environment now is people are using this triple action cream, this Bombactase, Kinil, and things like that, which have steroids in them, which worsen fungal infections in the long run. They give you a short fix, but give long term, they prolong um the condition. So you want to be very cautious. Don't use triple action creams. But see a dermatologist, make sure it's really a fungal infection. Get the right treatment, plain antifungal creams, not the ones mixed with steroids. And if it's a fungal infection, usually clears off after some time. But if it's persistent and keeps coming and going, then it may be something else. It may not be a fungal infection.
Thank you very much, Doctor. So another question is that what causes skin tags and what's the remedy? And in addition to that, can we use things like imidine, Perfectil, those line of drugs? So
Yes.
thank you.
So skin tags are caused by a combination of genetic predisposition, hormonal changes, aging, and sun exposure. That's why a lot of people develop them during pregnancy because of hormones. And then later on in life, as we get older, they can come up again. And then if you notice, people that have skin cells on their face, usually one of their parents or both their parents or aunties may also have it. So it's a genetic or a familial thing. And unfortunately, if it's in the family, it's almost inevitable that you have it. But you can reduce the risk of developing it by using sunscreen. Sunscreen used regularly can reduce skin tags. And then we are seeing people getting skin tags at a younger age because so many people are using skin lightening creams. We did an estimate and found that at least 50% of us in Nigeria are using skin lightening creams. Out of that 50%, about 20% don't realize they are using skin lightening creams because they don't even know that the cream is a lightening cream. And if you're using lightening cream, it increases sensitivity of your skin to the sun. And that can increase the risk of developing skin tags. So we are seeing people develop skin tags at a younger age because of skin lightening creams and they're not using sunscreen. So if you have it, use sunscreen. They can also be removed by a procedure. We call it electrocautery, when we burn them off or pinch them off. And, we ask you to use sunscreen to prevent recurrence. So for the other question, which was on,
Imidine,
mentioned, what was it?
Imidine,
Yes, so
Perfectil.
supplements, yes, so they are used once in a while, but like I said, the best thing is to eat a healthy diet. If you eat a healthy, nutritious diet, you may not need to take supplements. And even though we do recommend supplements for a lot of our dermatology patients, usually we usually also emphasize a healthy diet. And then you don't want to take too many supplements because they can put pressure on your kidneys, or your liver. And even if you are using these supplements, you don't need to use them every day so that they're not putting too much pressure on your body organs to clear out the excess. Because too much of anything is bad, including some of these multivitamins in these supplements.
So thank you so much, Doctor. So someone wants to know that as a teenager who has an oily face, or I'm sure oily skin, and enlarged pores, how do I care for my face?
Well, it's important to use products that, will help to control or reduce the amount of oil if you have oily skin. So, and then you also want to use products that will not clog the pores. So there are some creams that are mainly oil-based. If you have oily skin, you want to avoid them and use things that are more water-based because you don't want to add extra oil to the oil you already have. And then there are some products that can help to unblock the pores. Enlarged pores usually is because of the oil being trapped in the pores. So if you can get some of the oil out, they are less enlarged. So you want to use
Hey, you
something
want
like
to
salicylic
play?
acid.
See your head.
Hello.
If you are considering making
So you want to use something like salicylic acid wash to reduce the oil. We usually ask people to use that at night. And then gentle water-based skincare products are better for oily skin.
Thank you, doctor. So someone wants to know if the weather of another country can cause skin tags.
Well, it's possible, but it's if the country is very hot. For instance, if you go to a place like the Middle East where there is a lot of sun, if you are going to a place like the UK or Canada, you're less likely to have it. But sometimes their summers can also be very hot, so you still want to use your sunscreen, your sun hat during the hot summer months. If you are living in the Middle East or a place that's very hot, you want to take sun protection very seriously.
So someone wants to know the cause of painful scalp.
Painful scalp can be caused by a myriad of issues. One of them could be if there is an overgrowth of fungus on the skin and there's inflammation, so the body is trying to fight off the fungus and it makes the scalp sensitive. So usually we ask people to use antifungal shampoos when they have a painful scalp, and this tends to help, and some anti-inflammatory creams. But if you have a seriously painful scalp, I would recommend that please see a dermatologist. There may be some other underlying hair condition, something like CCCA, which may eventually lead to hair loss. So painful scalp must be properly investigated by a dermatologist.
Okay, thank you, doctor. So someone said shea butter and coconut oil. Are they good for the body as cream?
Yes, I actually use both of them from time to time personally. Shea butter is fantastic. In fact, a lot of foreign companies are now coming to Africa to steal our shea butter and
Mm.
put it in their skincare products.
Skincare
You
products.
know, so shea butter is very good. The challenge we have with shea butter is the production and the packaging. Sometimes the ladies that produce it, they don't store it hygienically. They just throw it in the ground or put it in a dirty container, and so it gets contaminated. But if you must use shea butter, try to get it from a hygienic source, not those people that just throw it on the ground in the market. If you do buy it from them, what I advise our mothers at last with is when you buy the shea butter, put it in a pot on the fire, heat it for about 5 minutes. So if there are any germs in it, you kill the germs. And if there's any sand in it, the sand will come to the bottom. You can decant it, and you know that at least you have sterilized it. And then you can use it on your skin or your baby's skin. But shea butter and coconut oil is very good for the body.
All right. So someone is asking if applying anti-aging cream on the face is good for someone who is 40 years old.
Yes, of course. Once you get to your late 30s, early 40s, that's the best time to start using some anti-aging or pro-healthy aging products. Things like retinols will help to reduce wrinkles and reduce aging of the skin. Things like peptides, creams containing peptides also help to combat the aging of the skin. So yes, once from your 30s and you want to start doing that too, and then you must use sunscreen, which will also help your skin to age more gracefully.
All right, thank you. So someone said, please, Dr. Cole, you once recommended Dove soap to me when I had Zoster. But recently I understand that Dove soap is being suspected to have some side effects related to reproduction. What can I use as an alternative?
Yes, sorry, thank you, ma. That's not correct information. Dove soap is safe. What happened is some batches had a fragrance that was banned by the EU. This fragrance was used all over the world. Then, of course, in Europe, they constantly check things, and they said, this fragrance, we don't like the fact that when we tested it on rats, some of the rats had some reproductive issues, so they banned it. So anyone made before 2021 that had that was banned and stopped. Now, sometimes in Nigeria, people keep things in warehouses for a long time, and they may have bought it before the 2021 ban, which it contained. But newer products of Dove do not have that fragrance, and I personally still use Dove. So what I tell people is if you are worried about that, try to check the batch when it was manufactured. Make sure it was manufactured after 2022. If it's manufactured before, please don't use it in case it's one of the batches that have that. Or better still, use the one that has no fragrance. Another alternative though, because some people are still like they are not sure. There are other soaps like Simple. Simple Bar is also very good fragrance-free pH balance cleanser that we dermatologists recommend and also affordable. So Simple is just called Simple. Is the brand name is Simple. You can use that. But Dove, as I've said, is still safe for use. And the problem was with a few batches that had a particular fragrance that is no longer recommended. You're muted, ma. You're muted, Dr. Saintel.
Sorry. So
Yeah,
someone wants to
okay.
know what can be done so that moles do not become cancerous.
Well, usually moles do not become cancerous in us dark-skinned people, but the only thing that we can do to prevent that is to eat healthily, to avoid excess sun exposure. And if we notice that a mole is changing, maybe it's becoming painful, itchy, is bleeding, or is getting bigger, please see a dermatologist early. But most moles on the face do not become cancerous at all, or any part of the body. But the places where you should be worried about when you see spots is on the palm of the hand, the nails, and the soles of the feet. Those are areas where we find dark spots that can become cancerous in us Black people. So anytime you see any black spots or discoloration on your palms and your soles, please be very vigilant and see a dermatologist as quickly as possible.
All right, thank you so much. So someone also wants to know how to treat hair fall on the front of the head.
So frontal hair loss often is as a result of traction, some of the styles that we have done, where we pull our hair, we weave our hair, we put glue. So the first thing is to stop any stressful hairstyles. Any style that will cause pressure or stress to the front hairs should be stopped. So we usually tell people to do gentle hairstyles or just cut the hair for a bit so that you can, have some free, the follicles in the front of the hair can rest. Then there are other things that you can do. You can apply in a spray where we call minoxidil. This can help also with regrowing the hair. In some cases, we do procedures like micro needling to try and stimulate the hair growth. And then we also check your blood levels because if your blood level is low, hair will not grow back very well. So if there's anemia, if there's low blood levels, we have to correct that for the hair to grow back properly. But the most important thing is to avoid hairstyling that will
All right,
affect
doctor.
the frontal hair.
Okay, so the last question, and if there are other questions, I'll just forward to you and then you can answer and send to me. So this is the last
Okay.
one. So someone is asking, is Dove soap suitable for oily skin and acne-prone skin? The person notices that she breaks out whenever she uses Dove soap on her face. So is
Well,
it recommended?
if you have oily skin, you're better off not using Dove because it's moisturizing and it's 1/4 boil. So you want to use a water-based cleanser, like I mentioned, that has limited oil. Example is the simple face wash, which is a simple cleanser that doesn't contain oil, and you can use that on the face. And then at night, you can use, like I said, a face wash containing salicylic acid, which will help to control the amount of oil in your skin. So if you notice that, please don't use it on your face, but you can use it on your body. Please, there's one more question that I must answer because it's very important. Somebody is asking, which better cream for eczema, Nixoderm or triple action? please, I would like to just say here that triple action cream should not be used for anything at all, because we are seeing problems from triple action cream. The steroids are causing damage to the skin, they cause stretch marks, they make infections complicated, they even cause resistance to treatment. Now we are having resistant fungi because of the use of triple action creams. So please, ma, do not use triple action cream for anything. If you have something that you think is eczema, which is what we call tinea versicolor, first make sure you're not using antiseptic soaps, you're not using antiseptic liquid, you're not using bleaching creams. That's number one. Then number two, use a plain antifungal, Nizoral cream, which is available everywhere. It doesn't have steroid in it, just plain Nizoral will take care of the tinea versicolor, what everybody calls eczema. That's what you should treat it with. All those mixed of antifungal, antibacterial, anti-inflammatory, please avoid them, especially for children, but also for adults.
All right. Thank you very much. Thank you so much, Dr. Oladefe. So I would like to say a very big thank you to you now on behalf of Her Excellency, the First Lady of Lagos State. Okay, sorry, Miss Olorunrinu is asking if about black soap. So that's very important because we use black soap a lot.
Yes, so black soap is okay, but it tends to be drying. If you have dry skin, I wouldn't recommend that you use black soap. If you have oily skin, you may be able to get away with using it, but if you have dry skin, black soap is not the best choice for your skin because it dries the skin a lot. Some people, because of the dryness, they add some oils into the black soap to reduce the dryness. That may help. But I usually don't recommend black soap to do with dry skin. But if you have oily skin, yes. And then if you're using your black soap, you must moisturize your skin very well with either shea butter or coconut oil after to reduce the drying effect of black soap.
All right. Thank you very much, Doctor. So we'll definitely be reaching out to you from time to time. I'm sure our mothers here, they want, their skin to really glow. Apart
Yes,
from
and if
the
you're asking for a
fact that they
recommendation
do
for
need
a
to.
skin doctor, I'm a skin doctor. I
Yes.
work in Lasuth.
Okay.
So if you want a
Yes.
consultation, you can come to Lasuth. Okay.
Okay. Thank you so much, Doctor. So we will definitely reach out to you on this. I'm sure a lot of us want to get in touch with you and for one skin condition or the other. So thank you for obliging us already. We're grateful. So now, on behalf of Her Excellency, the First Lady of Lagos State, Dr. Mrs. Claudiana Ibijoke Sanwo-Olu, the wife of the Deputy Governor, Chief Oluremi Hamzat, our team lead, Professor Olufunke Adeyeye, and the entire medical think tank committee, and indeed the entire council body, we want to say a big thank you to you, Dr. Kola Adefe, for this insightful lecture that you have given unto us today. We're grateful. And I'm sure a lot of us now know better than we did. Unfortunately, we don't have our tests. We were supposed to have some pre and post tests. So we're not able to do that. Have actually taken some post test questions now. So thank you so much. And thank you, Doctor. And thank you,
Thank
everybody,
you
for
so much.
coming. We're grateful. Have a lovely night
Thank you
rest.
so much. Remember, there is no health without skin health. So take good care
Yes.
of your skin. Thank you.
Thank you. Thank you,
Thank
Doctor.
you.
Thank
Thank
you.
you, doctor.
Thank
Please,
you, everybody.
we would love to have your contact,
Thank you,
please.
doctor.
Okay,
Okay.
I'll
Our
share it in
contact.
the
Doctor.
chat
Okay.
box.
And the
Thank
Instagram
you,
page as
Dr.
well.
Cole.
Yes, the Instagram. That you said we should follow you on Instagram.
Yes, please
Mm.
follow on Fola Demadoc.
Okay.
I will send you my Instagram IG.
I hope everyone can see the phone number. Hello,
Let me
Mas.
see.
I hope you can see the phone number. It's on the.
No,
It's
I can't say it too, please.
it's in the chat box, ma.
Okay. All right.
Or do you want me to? Do you want me to call out the numbers? 080 371 33 139. Dr. Folakemi Koladefe.
71.
33
But I've finished.
139. Okay, ma. So you can
Thank
reach
you.
out to
Thank
her.
you.
All right, ma.
Okay.
Thank you very much. Good night. Good night, everyone.
Thank you and good
Good
night,
night.
everyone.
Thank you so
Good
much,
night,
Thank you,
Doctor. Thank
everyone.
doctor.
you. Good
You
night,
too,
ma.
doctor.
Thank
Good
Bye.
night.
you. Thank you, doctor.
Good